The origin of 得气 or arrival of qi can be traced back to the inner classic. There are several chapters having 得气 related texts. Let's see them one by one. In the first chapter of the spiritual pivot, 9 needles and 12 yuan source points, there is the most famous text on 得气. It says, do not care about the time if qi doesn't arrive after needling. If qi has arrived after needling, the needle can be removed and further needling is not needed. Needles have different indications due to their different shapes, and they should be selected according to their functions. The key point of needling is that effect is achieved on the arrival of qi. The manifestation of the effect is just like wind blowing away clouds to show the bright sky. This is the ultimate of acupuncture theory. Please note the sentence with the star mark. The key point of needling is that effect is achieved on the arrival of qi. In modern textbooks, it's said that 得气 is closely related to the therapeutic effect of acupuncture. It's exactly on basis of this statement. But we may also notice that it says when qi arrives, it's not necessary to do any treatment, and the needle can be removed. This is totally different from modern manipulation, which requires reinforcing and reducing techniques after 得气. Another thing is, it says after 得气, the effect will be very obvious, just like the wind blowing away clouds to show the clear sky. Can we have such significant effects in acupuncture clinic? Of course, there are some, but certainly not all. I'm confident that I can induce 得气 in almost each patient, but I dare not boast that my acupuncture will have so obvious effect as frequently as 得气 appears. So, what can we see from this text? 得气 is closely related to the therapeutic effect of acupuncture. This is the same as modern concepts. But what about the manipulation? It's totally different. In the inner classic, no further treatment is necessary except for removing the needle. And how about the effect? Modern acupuncture doesn't seem to have such magic effect after 得气 is induced. Bearing these questions in mind, let's continue with other texts. Then, in the third chapter, the spiritual pivot, explanations of the small needle, it says, the sentence that qi movement in the acupoint is quiet and insensible means that the needling is to achieve 得气, which requires careful observation so that the time for needling won't be missed. We know this chapter is to explain the first chapter, 九针十二元, and this sentence is to explain the expression of qi movement in the acupoint is quiet and insensible in that chapter. The explanation is the purpose of needling is to achieve 得气, and 得气 requires observation for correct timing. Here, we only need to pay attention to the term 得气. In the first chapter, it uses arrival of qi. Here it's 得气, and they are the key or purpose of acupuncture. Nowadays, they are of the same meaning. That's because in the inner classic, they are of the same meaning. And we'll see further evidences of this judgment in the following texts. Then, in the chapter of ending and beginning, it explains the meaning of 得气 and also how to judge 得气. It says, the saying that effect is achieved on the arrival of qi means that the excessive will turn deficient by using reducing techniques, and deficient means that the pulse may be as large as the original, but it's not as strong as before. If the pulse is still as strong as before, the disease is not cured even if the patient feels better. The deficient will turn excessive by using reinforcing techniques, and excessive means that the pulse may be as large as the original, but is stronger. If the pulse is the same as before, but not strong, the disease is not cured even if the patient feels better. So, What's 得气? It's the excessive were turned deficient by using reducing techniques, and deficient were turned excessive by using reinforcing techniques. How to judge it? By taking pulse, especially the strength of the pulse. Using reducing techniques, 得气 is the pulse turning from excessive to deficient, and it mainly refers that the strength of the pulse decreases. Using reinforcing techniques, 得气 is the pulse turning from deficient to excessive, and also the strength is the main consideration. It should be stronger than before. According to the text, patient's feeling is not important. If the patient feels better, but the pulse doesn't change, it means acupuncture doesn't take effect. We can learn something from this judgment. The patient may feel better, but that doesn't mean he's cured. In clinic, such kind of conditions is quite common. In the same chapter, there is also a term of 骨气, or arrival of 骨气. 骨气, literally, it means 气 of the cereal, in Chinese character 骨气. The related texts are, all needling methods should achieve 骨气 through 3 needling. So the first needling is to let out the yang evil. The second needling is to let out the yin evil. And after the third needling, 骨气 will arrive, and quit the treatment on the arrival of 骨气. The so-called arrival of 骨气 means that it becomes excessive after the application of reinforcing techniques, and it becomes deficient after the application of reducing techniques. Therefore, it's known that 骨气 has arrived. When evil qi arrives, it's tight and rapid, while 骨气 comes, it's slow and soft. In this text, it first introduced a needling technique called 3 needling. In this technique, the needling depth can be divided into 3 layers: the superficial, which is the skin, the deep, which is the muscle, and the middle, which is between the 2 layers. 3 needling is to let the yang evil out from the superficial, let the yin evil out from the middle, and finally achieve 骨气 in the deep layer. And the methods to judge the arrival of 骨气 is the same as before. After using reinforcing and reducing techniques, it becomes excessive or deficient. Obviously, it here refers to the pulse. It also mentioned that after 骨气 is achieved, the needle can be removed. So we can know arrival of 骨气, arrival of qi, they are judged with the same standard. And after arrival of qi or 骨气, the needle should be removed. The arrival of qi and arrival of 骨气, they are the same thing. 骨气, the qi of the cereal, it can be regarded as qi of water and cereal, the vital qi. In this text, it also describes one more thing. When evil qi arrives, it's tight and rapid, while 骨气 comes, it's slow and soft. What does this it refer here? From previous texts, we know it's quite certain that this it refers to pulse, as in the whole chapter. But can this it be understood as other meaning? Also, please keep this question in your mind. Here's another paragraph in the same chapter. It says, during the application of all needling methods, the body and qi should be observed. The practitioner should concentrate Shen and pay attention to the needle. The needles may be inserted shallowly and retained, or inserted slightly and superficially, so as to guide Shen of the patient. Quit the treatment on the arrival of qi. When yang qi goes into the body and yin qi comes outwards, the vital qi can be protected from losing, and evil qi can be prevented from invading. This condition is called 得气. This text is about the treatment of a disease. The doctor should pay attention to Shen and use some gentle stimulation, and then qi arrives. Quit the treatment. This is the same as other texts in the inner classic. And this text describes the condition of 德气. The vital qi is protected. The evil qi is kept out. Previous chapters are from the spiritual pivot. Now let's see some text from basic questions. In discussion on the separation and combination of genuine qi and evil qi, it says, insert the needle when the patient inhales so as to avoid reversal of qi. Retain the needle quietly for a long time and do not let the evil spread. Twist the needle when the patient inhales for the purpose of 得气. Pour out the needle when the patient exhales and remove the needle when the exhalation is completed. Thus, the evil qi all comes out, and this is called reducing. The paragraph is selected from Qi Bo's answer to Huang Di's question, and it's about the introduction to the manipulation of reducing techniques. Then the reinforcing techniques. It says, the emperor asked how to perform the reinforcing skills for the deficient. Qi Bo answered, first, feel the acupoint and move the finger along it. Then squeeze the acupoint to disperse the qi, and then push and press the point. Then flick the point so that the vessel will be full. Then nail the point and insert the needle. When qi flows smoothly, remove the needle and at the same time pour the door from the outside to shut Shen in. The needle should be inserted when the exhalation is completed, and the needle should be retained quietly for a long time for the purpose of arrival of qi, as if waiting for a distinguished guest. One will not care about whether it has been nightfall. When qi arrives, it should be carefully maintained. Pour the needle when the patient inhales, thus qi won't come out. Each needled place should be pushed to close the door to maintain Shen qi and preserve meridian qi, and this is called reinforcing. The two texts talk about the reinforcing and reducing techniques, and respiration is very important in the manipulation. In different phases of the breath, different needling skills should be applied, but here we shall mainly focus on 得气. In both the reducing and reinforcing techniques, 得气 or arrival of qi is mentioned, either for the purpose of 得气 or for the purpose of arrival of qi. So from here, again we can know that 得气 is the same as arrival of qi. The other thing we should know is that after 得气 or arrival of qi, the needle should be removed. So here, the theory is consistent with the spiritual pivot. Now let's have a summary on 得气 theory in the inner classic. There are arrival of qi and arrival of 骨气 in the inner classic. From the explanations in the chapter of ending and beginning in the spiritual pivot, on that effect is achieved on the arrival of qi and arrival of 骨气. Both of them are judged by the powers and have the same criteria. That is, the excessive will turn deficient by using reducing techniques, or it becomes excessive after the application of reinforcing techniques. The deficient will turn excessive by using reinforcing techniques, or it becomes deficient after the application of reducing techniques. So, arrival of qi is a shorter form or abbreviation of arrival of 骨气. In the inner classic, it's through the pulse to determine whether arrival of qi or arrival of 骨气 is achieved. That is, to determine whether acupuncture has effects or not. There's also the saying of 得气 in the inner classic. According to the simultaneous appearance of for the purpose of 得气 and for the purpose of arrival of qi, in the discussion on reinforcing and reducing techniques, they have the same meaning. In the inner classic, arrival of qi is the ultimate purpose of needling manipulations. Before the arrival of qi, one should not care about the time and can perform a series of manipulations, including those to insert the needle when the patient inhales, to feel the acupoint and move the finger along it, then squeeze the acupoint to disperse the qi, and then push and press the point, then flick the point so that the vessel will be full, then nail the point and insert the needle. When qi flows smoothly, remove the needle and at the same time pull the door from outside to shut Shen in. The needle should be inserted when the exhalation is completed, so as to achieve the goal of arrival of qi. After De qi, it should be that if qi has arrived after needling, the needle can be removed and further needling is not needed, or quit the treatment on the arrival of qi. And this indicates that no further treatment is needed after the arrival of qi, except for the removal of needle, which is to pour the needle when the patient exhales in reducing techniques, or to pour the needle when the patient inhales in reinforcing techniques. Such discussions are in accord with that effect is achieved on the arrival of qi. The arrival of qi indicates the effect of acupuncture, so further stimulation is not necessary.